I thank both chairmen. Ms. Turner, do you think insurance exchanges are free market?
The exchanges are, when you have Washington setting the rules for what the health insurance has to be, 60%, 70%, 70, 80%, 90% actuarial value, with so many rules and regulations, with consumers having a choice of only 4 plans that are basically cookie cutter. No, I don't believe so. I believe that consumers on their own would find, and the market would provide many more choices.
Right. In fact, do you think we have those choices now? Or not?
No, we don't have those choices now, and I think that that's really was the challenge that we should have been addressing, is what can we do?
We really don't have a free fluid market.
That's right.
And why not?
We don't have a free fluid market because consumers aren't able to be consumers. That the tax treatment of health insurance so incentivizes in the past people to get their health insurance through their workplace, where they're told to, this is the choice that we can offer. They may or may not like it, but that's all they get. If we had a free open market where people are able to shop for their own insurance, their health care is a different thing, shop for their own insurance, then they would be able to force the market to provide much more affordable and diverse options.
Thank you. And following along on that same line of questioning to Dr. Holtz-Eakin, how much of the insurance market or even the health care market is run by the government through programs or regulations?
All of it at some level. I mean, this is a highly regulated
All of
industry.
it?
Yeah. I mean, we have standards for providers, licensing. We have standards in the state insurance markets. We have enormous public payer programs in Medicare, Medicaid, now the Affordable Care Act. It's hard to describe any of this as market-driven.
Okay, so Mr. Pollock testifies that he'd rather keep going in this direction. What would that lead to?
I am deeply concerned about the future under the Affordable Care Act.
How would the members of Mr. Pollock's organization fare into the future if we keep going down this road?
Number one, in the end, it is the quality of economic growth that determines the incomes you have to spend on everything, including health care. And this is bad economic policy from the word go. Number two, it left unreformed to a great extent programs, Medicare and Medicaid, that are intended to serve our seniors and poor, but do so in quite a substandard fashion. We have not gotten rid of fee-for-service medicine. We haven't solved the problems in Medicaid. Those problems are going to remain and indeed expand if we go down this path. We have set up on the care side an enormous incentive for consolidation and monopoly power. That's not going to lower anyone's costs. It's going to raise costs. And, on the insurance side, we have essentially turned this into a large nationally regulated utility, and I don't think we're going to get good performance out of it.
Okay, thank you very much. Mr. Richardson, switching up a little bit, how do you in your company handle employees who have pre-existing conditions?
They're included in the insurance, so we take care of that, that way.
Do you have any idea how much your increase in cost is? Have you ever done any kind of analysis?
I don't have a specific number on that. We could put the study to it and get back with you a specific number.
But the point is the private sector is handling pre-existing conditions, yes or no? What's your opinion?
Yes, and I think what we've started to do another way, and I welcome Congressman Andrews' comment on thoughts and ideas. It's one of the things that helped us a lot at White Castle is a real focus on wellness. So we started paying for preventative visits, covering 100% of the copay, and we've seen that have a real positive impact, just in terms of general common sense solutions that help our people.
And why did you start doing that? What was your motivation?
Costs were increasing, and we're looking for ways to, first and foremost, we care about our 10,000 people, but we also recognize that it could provide us the chance to have lower health care costs.
Mm-hmm. And do you find that you probably have a wide disparity of income salaries and hourly wages across your organization? What differences do you find across those wages and salaries and incomes in terms of how people react or care for themselves or their families in terms of their health?
Well, first and foremost, our founder believed in providing freedom from anxiety and recognizing the dignity of each team member. So if we're lucky enough and we do our job, we're able to have someone stick around and be part of our team for the long haul. And what we know is more what's in common. that if we provide good education and good access and awareness of what the benefit is, it's going to be there for people when they need it the most. So I don't know if I could call out specific disparities, but I know that we are in a lot of urban areas, we're in rural areas, suburban areas, but we try to focus on what's in common, which is that freedom from anxiety that our plan provides.
Thank you. I see my time's expired.